Hello, I'm Silvana Tering. I'm living in Germany. I'm a general dentist and I'm focused on indirect solutions. In some cases, and there are quite a few, the tooth position is unfavorable for minimally invasive or non-invasive procedures. Previously, I referred such cases to an orthodontist, but for several years now, I've been treating some of these cases myself with aligners and I've noticed some advantages. First of all, the patient remains in the office. I have more control over the treatment because I always keep the goals of the final prosthetic restoration in mind, and I can intervene quickly if necessary. So this allows me to work very efficient. A typical example from my daily practice would be this case, where the patient comes in when wanting to replace her missing posterior teeth in the lower jaw. The clinical situation is more complex because the adjacent and opposing teeth have shifted into the gaps. There is a crossbite on the right side, and on the left side, a very unstable head-to-head occlusion. She has crowding in the anterior region and a reduced overbite and overjet. In this case, I used the Clarity aligners from Solventum. We needed 20 aligners. The patient had 4 attachments in the upper jaw, 9 attachments in the lower jaw. I needed to do some IPR, but just 0.2 millimeter in 4 places in the anterior area. And through this orthodontic pre-prosthetic treatment, I was able to achieve the recalibration of the prosthetic spaces, improvement of the occlusal planes, correction of the head-to-head occlusion on the left side, alignment of the anterior teeth, and improvement of the overbite and overjet. After this phase, my prosthetic treatment was minimally invasive. I used adhesive bridges to restore the edentulous areas as the patient did not want implants, and I performed overlays and partial crowns on the upper molars. The treatment lasted approximately 7 months in total, with the aligner therapy alone lasting approximately 5 months. Overall, I've achieved a better functional prognosis and improved aesthetics for my patient. I hope this brief case presentation was helpful to you, and I hope it gives you the courage to try it out yourself. Thank you for watching. Bye bye.